morning. It is Tish. Happy Sunday. Today is March the 6th, and I'm just going to come to you with a real quick video. It's more of a warning, a cautionary video for not just those that are recovering from the reconstruction surgery, but anyone that is recovering from surgery or anything. Let's talk blood clots. So I spoke in my last video about, making sure that you were careful about not to get blood clots, doing the feet exercises, moving around and things of that nature. Well, I discovered Thursday I have a blood clot in my leg. So let's rewind. Earlier that week, I started feeling like a cramp. Just like a minor, just kind of pull or just kind of twinge of something in my calf. And I was like, thought it might have just been like a cramp because I've been having my legs elevated, having them kind of in a different position. And over the course of the following days, the uncomfortability increased. So to the point where when I would take a step, first thing in the morning or sometimes during the day, I would actually have to hesitate to take that step, or I found myself putting not so much pressure on it. So Thursday morning when that happened, I said, nope, this is a blood clot. And so I already had an appointment scheduled for that morning, for that day with my plastic surgeon, just to do my checkup, see how things were going. So I sent a note to his office and said, hey, can you go ahead and put in an order for me to have a scan, because I think I have a blood clot in my leg. And immediately, like once his assistant got the message, she said, absolutely, you should be getting a call momentarily. So sure enough, about maybe 15-20 minutes later, after I read that message, I was getting a call from the hospital to set up an appointment. They had availability that day, which happened to be an hour before my scheduled appointment. So I went in, they did the ultrasound on my entire left leg and in the groin area of my right leg. And I knew that it was a blood clot when she did the scan, because she was asking me, she was like, so is it in this area? This is kind of the area where you're feeling it? And I said, yes. And she was like, okay. So after I cleaned up and I got dressed, she was like, the radiologist is reviewing the information. You can go ahead and go down to Dr. Gordon's office. Cool. Headed that way anyway. I have an appointment at 3. She was like, okay. So then I get to Dr. Gordon's office. I'm waiting. I get a call from my oncologist, her nurse. And she said, hey, Miss Petty, are you still at the hospital? And I said, yes. And she was like, are you with Dr. Gordon? I said, I'm sitting in his office. And she was like, okay, so after you leave his office, come down to us. Dr. Gordon is on 3rd floor. Dr. Ramshes, who is my oncologist, is on the 1st floor. And I said, well, I have another 30 minutes before I'm scheduled to meet with Dr. Gordon. And she was like, okay, come on down now. Let's chat. Went down. She was like, yep, this is a blood clot. So this changes the game. This changes everything. And I was like, okay. And she was like, good listening to your body and knowing when something doesn't feel right. You did the right thing. It's a small blood clot, but it's a blood clot. And we don't want it to get larger, and we don't want it to break off or travel anywhere else. So stop the tamoxifen. I told her I wasn't on the tamoxifen. She was like, okay, because you'll never take it again. I've already sent over to your pharmacy a prescription for Xarelto. So you'll have to take this. And I was like, for how long? And she was like, for about 6 months. And I was like, damn. She was like, but Dr. Ramshesh is going to call you in the morning, and you'll have a more thorough conversation with her, but for now I'm just trying to get this started. So don't take the tamoxifen anymore, and you'll be on the Xarelto for the next 6 months. Begin taking it immediately. I'm putting you out of work for an additional couple of weeks because I know that you work from home, but I know that you sit a lot. And even if you have, and because I told her, I said, well, I have one of those desks where I can stand or sit. She was like, but the fact is, you are in a lot of meetings, and you've said yourself that you can find yourself in back-to-back meetings, and that means no movement. And so even if you're standing for these back-to-back meetings, there's no movement, and we need movement. Not, you know, a whole bunch of like jumping jacks or, you know, jogging, but we need for you to be mobile. So I don't want you back at work right now. I know you were planning to go back on the 14th. Let's delay that for a little bit longer, just till we can get this course going and we can recheck that blood clot, make sure everything is fine. But Dr. Ramshesh is going to talk to you because this does change the course of your treatment for cancer, because tamoxifen causes blood clots. And we can't have you now being prone to blood clots, taking a medication that causes them. So we have to change the course of that, but she'll talk to you about it tomorrow. So I said, okay. And she said, no travel. No travel for anything greater than 50 miles for the next 60 days. And I was like, damn. I have a work conference that I have to travel to the first week in April. And there was a retreat that I wanted to attend in Atlanta in May. And I can't do it right now. So, a lot is changing. So, spoke with Ramshesh on Friday, and she told me that I will no longer be able to take the tamoxifen because of the blood clots, and that we are going to discuss next week what my course will be. She's going to have to put me on a medication now, because on a different medication, but it's going to be one that will that she typically would have put me on after the first part of the 5 years. That second 5-year time frame, she would have put me on it then, but she's going to have to change me to this course now because the blood clots. But I have to since I have active ovaries, they're now going to have to suppress my ovaries so I can begin taking the medication. And they're going to suppress them for a while because I have the blood clot, and they can't do the surgery to remove my ovaries because of the blood clot. We have to wait. So because she doesn't want to delay any further me taking the hormonal therapy for the cancer, we need to now suppress the ovaries until she can remove them safely. So I'll be getting a monthly injection to suppress my ovaries so I can now take this new course. And then once I'm cleared to have surgery, then she'll remove the ovaries. And then I won't have to receive the monthly injection to suppress the ovaries. Because the tamoxifen is the only medication that you can take when you have active ovaries, according to her. I've asked her to send me the information about this medication so I can do my own research, so I can just run it through our services at work that does the second opinion, because I want to just make sure that we're not doing anything different. My oncologist and my surgeon feel like it's a combination of the tamoxifen and the surgery that could have caused the surgery, or even the fact that I sit a lot and I'm sedentary a lot during the day at work. just could have been just a snowball effect of that. We just don't know. I did the best that I could to be mobile and to move my feet, do the exercises, do the breathing exercises, but somehow it happened. So, still processing how I feel about all of this. It's a little disheartening because you don't know. It's such an unknown. But it's just one of those where it's like, again, it's not within my control. And there's nothing that I can do about it other than trust that God is in the midst of this. One, to trust that I am with caretakers and providers and medical professionals that are doing the very best that they can, and that my body is responding in such a way. Now, I felt like over the last couple of weeks I could have been more mobile, but this surgery really takes a lot out of you. And then mentally, if you're not really in a good place mentally, it's just a lot to process, and it's a lot. You're taking a lot of medications, and you're dealing with just the surgery and the diagnosis and people and their ish. It's just a lot. So I don't really know how I feel about it right now. I know that I'm, I guess, a little sad, but I don't know what else. So I'm just kind of working through and processing through. But caution to anyone, especially those that are going through this surgery. Please try and be as mobile and have movement as you can. Push yourself, not too hard, not do anything strenuous, but walking, not even just in the house, like go outside, take a stroll outside. Even if you stroll just up the, block or two, do it more than a few times a day, even kind of your first week home. Push yourself to get out of the boundaries of that home, to move your body, to keep those limbs moving, but also when you are sitting, be elevated. Have those legs elevated. And that was probably one of the things that I didn't do, I think, as good of a job of, is just making sure that when I was sitting down or laying down, my legs were elevated. Because sometimes I felt like maybe I'm laying around too much and my legs need to be down. I need to be, I don't know. I can't go through the what ifs and the should haves and the could haves and the would haves. I already got people that'll do that. I can't do that to myself, but all I can do is just take today, move forward, listen to my doctors, listen to my body, because luckily I listened to my body and I acted as quickly as I did. Because it could have been worse. I could have been like, oh, that's just something funny, and it could have ended differently. So just a quick update, just a quick video, just a cautionary tale, but that's kind of what's going on now. Excuse the hair, I'm letting it air dry because I have a retightening tonight. So I washed it, got up this morning, washed it, sprayed it with my refreshing spray, and now I'm just letting it air dry naturally. So just finished watching church not too long ago online, came out to my shed, my studio area, to just kind of chill for a little bit, and said, let me just do this video. I was going to wait until next week, but I said, no, let me do it now, because again, be careful. But one of the things I did want that I think has been really helpful is, like I said, this Juven. This is a sample packet that my plastic surgeon gave me. You can really only find them at CVS and Walgreens. So I take these twice a day. I drink this twice a day. And I think it's really helped me to kind of start feeling stronger. in these areas. Taste is not bad. It just kind of has like a chalky aftertaste afterwards. But again, got my Xarelto that I'm taking and I'm reading on for the blood clots. So do your research, listen to your body, listen to your providers. If you have a provider that you're not confident in, find you another one. But be diligent and use your voice to advocate for yourself in your care. Happy Sunday. Hit the like button. Talk to you later. Bye.